Hello, I'm Dr. Hiba Naeem. Welcome to the Health Talk on Dental News. Today we have a special guest with us, Dr. Ain Malik. Dr. Qurat is a board-certified periodontist and implant specialist in the USA. She graduated from Fatima Jinnah Dental College in Karachi, Pakistan. Then she went to US. She did her DDS from New York University, and from there she's continued her residency training program in periodontics and implant dentistry. Prior to that, Dr. Qurat also received certification in periodontics from UCLA. Can you provide an overview of the expertise in implantology and periodontics?
So periodontist is basically a specialty in dentistry who specializes in diagnosis, in prevention, and in treatment of any disease that is pertaining to the gums and around the bone of the teeth, and also in the placement and in the maintenance of dental implants. When I say in the placement of dental implants, it also means that if there is any lack of bone, if there is any insufficient thickness of the gums, we regenerate bone, we regenerate the lost tissue, and then we make sure there is ample space for the placement of implants. So that's where we come into play to protect the tissue and to protect the bone around the teeth, basically.
What is your advice to an individual? How can they maintain their good oral hygiene?
That's pretty simple. Make sure you're brushing your teeth twice a day. You're flossing after every meal. You're using a soft Bristol toothbrush. And don't go very vigorous on your gums, because the more you brush your gums like very vigorously, the more it will cause recession, and you definitely don't want that. Be very gentle and brush twice a day. But consistency is a key. Like if you're brushing today and you're like, oh, tomorrow I don't want to brush my teeth, then that's actually not helping at all. So brush twice a day, floss and rinse, be consistent.
Okay, so gum diseases such as gingivitis, periodontitis, what causes these? And what are the warning signs that one should look out for?
So basically, before we thought that it's only the plaque that causes gum disease, but there are a lot of factors that are involved in gingivitis and periodontitis. But the most common one would be plaque and how our body responds to it. Formation of plaque is very normal, but if we do not remove it by cleaning, professional dental checkups, then it starts forming as tartar. It's a collection of bacteria that kind of forms around your oral cavity, and once the tartar is formed, it kind of releases toxins and starts breaking down your tissue. So if your gums are not pink and they are not firm, so pink and firm means that your gums are healthy, but if they're not pink, they're not firm, they're very tender, they're red, and constantly there's pus coming out, you feel that your gums, your teeth are actually moving away, they have shifted from the place where they were before, there's tenderness. All these are the symptoms of gum disease, and you should definitely make sure that get a checkup from your dentist.
So all of these consequences that you've already explained, can these affect a person's normal well-being?
Yes, untreated gum disease can cause increased risk of diabetes, stroke, and other cardiovascular conditions. For example, if there is tartar that stays in the mouth for long, the toxins are released into the bloodstream and they kind of clog your arteries, and that can cause stroke. Similarly, if you have diabetes, it's increase in sugar level, and that sugar level kind of creates an environment for certain types of bacteria to grow, and that can cause periodontitis. And same way, if you're not treating diabetes, then it will be difficult for you to control. So there's a bidirectional relationship between diabetes and gum disease. So we have to make sure that overall health is, we have to make sure that we take care of our mouth, so our entire body is taken care of as well.
Okay, how important is patient education when it comes to managing these gum diseases?
So patient education is the critical part in the entire treatment. So for example, once the patient walks into your clinic, what I recommend is that spend time, interview the patient, talk to the patient, even if it takes like 30-40 minutes, invest that time telling the patient the problem the patient has, how to prevent that in the future, and how the treatment would benefit the patient. Give them brochures, give them, show them videos and demonstrate them how to brush, how to floss, how to rinse, Things like that would actually help in educating the patient, and then they would be able to better take care of themselves. So yeah, it's very critical and we should do it, and the first appointment matters the most.
So since you've also studied in Pakistan and in USA, what do you think are the similarities and differences in dental education when you compare both the countries?
Interesting question. So let's talk about the similarities first.
Yeah.
So here the BDS is 4 years.
Yeah.
It's the same thing. The DDS or DMD is 4 years, and then here we do house job, which is a year training. It's the same. We do a GPR training or a AGD training. It's similar to what we do here. So this is a similarity. Now the difference is when we go deeper into that 4-year program. So the didactic in the US is very intense. It is very intense. In addition to teaching us endo, perio, ortho, these subjects, they also talk about time management, patient management, risk management. So which kind of help us get trained better, I feel, and we would be, it makes us, I feel it makes us a better clinician overall. Also the clinical hours are pretty intense because I'm going to talk about NYU because that's what my experience is about. In NYU we used to start at 8 a.m. and our clinics used to end at 8 p.m. So they kind of trained us to work late hours as well. So the more you stay in the clinic, the more experience you get, and the more techniques and skills you have to better manage the patient. So that's the difference in both in terms of didactics and clinical hours. It's pretty intense and extensive in the USA.
So what are the benefits then?
Yeah, you would be, it helps you treat patient overall. So I don't see, if a patient comes to me and there's a problem in the mouth, I will not only look at that little portion, a little problem that's coming to me, hey, treat me, no. I look at the patient overall, we ask them about their health, we ask them what their nutrition is, what's their lifestyle is, and we try to give them evidence-based treatment that would help them, and we try to provide them with different options. And we make sure that those options are, we make sure that those options have no risk in treating them, and mostly our treatment is based on evidence-based dentistry. If there's no stronger evidence regarding any treatment, I personally and most of the doctors, we don't provide that treatment. Even if it is very cost effective for the patient, we tell them that this would not help you much, this will not benefit your health, this will not benefit the outcome. Maybe in the short term you will see, hey, there's improvement, but in the long run you won't be able to maintain it, you won't be able to have those results. So it all depends on the evidence-based treatment. Yes.
Okay. So we all know that studying abroad costs a lot.
Yes.
So is there any financial aid, is there any scholarship that foreign students can take advantage of?
There are financial aid options. Actually 80% of the students take that option. So you don't have to pay the tuition in one go, you pay in increments. That makes it easier for the students. But also keep in mind that there's something I really want to tell everyone, that on the brochure and on the websites they say, hey, the cost of this program is this much. But they don't tell you about the cost of transportation. They don't really tell you about the cost of meals. They don't tell you about the cost of housing. So there's always additional costs in addition to whatever they're mentioning on the brochure. So look into that, and yes, there are financial aid options. In terms of scholarships, I don't think so. There are scholarships for the TDS program, but if you're doing any other program in which you're planning to come back to Pakistan and serve the country here, for those programs there are scholarships, but not for the DDS, not that I'm aware of. They could be, but not that I'm aware of. And yes, financial aid option is there. You can take loans and pay off later on. And yes, I actually got this question. This is an additional thing that I'm telling you. I got this question yesterday. A friend of mine asked me, hey, it takes 10-15 years to pay off loans. I don't think so. I want to do DDS in the US. So I want to tell you, no, it does not take 10-15 years. I know people who have paid off in 5 years. So if you work hard, if you work smart, you try to do morning clinics, evening clinics, just cut down your lifestyle for first 4 years, and then trust me, you will pay off your loans. So don't let this discourage you, please.
So are there any internship opportunities for students to apply in the USA?
There are financial aid options. Actually, 80% of the students take that option. So you don't have to pay the tuition in one go, you pay in increments. That makes it easier for the students. But also keep in mind that there's something I really want to tell everyone, that on the brochure and on the websites they say, hey, the cost of this program is this much. But they don't tell you about the cost of transportation. They don't really tell you about the cost of meals. They don't tell you about the cost of housing. So there's always additional costs in addition to whatever they're mentioning on the brochure. So look into that, and yes, there are financial aid options. In terms of scholarships, I don't think so. There are scholarships for the TDS program, but if you're doing any other program in which you're planning to come back to Pakistan and serve the country here, for those programs there are scholarships, but not for the TDS, not that I'm aware of. They could be, but not that I'm aware of. And yes, financial aid option is there. You can take loans and pay off later on. And yes, I actually got this question. This is an additional thing that I'm telling you. I got this question yesterday. A friend of mine asked me, hey, it takes 10-15 years to pay off loans. I don't think so. I want to do DDS in the US. So I want to tell you, no, it does not take 10-15 years. I know people who have paid off in 5 years. So if you work hard, if you work smart, you try to do morning clinics, evening clinics, just cut down your lifestyle for first 4 years, and then trust me, you will pay off your loans. So don't let this discourage you, please.
What are the typical procedures
Yeah.
or requirements when you're applying to study abroad? Like, is there a language proficiency exam? Is there like an academic criteria that you have to go through for you to get into a university?
So this is a really good question, and we just did a seminar a few days ago in a university to explain this. It takes an hour to go through the details, but I'm just going to tell you the bits and pieces and the important stuff. So just remember, you have to take TOEFL exam. That's a must. TOEFL exam and a score of 92. If it's less than 92, it's not very competitive. So if it's 92 and above, then yes, it's a very competitive score. Then you have to appear in the national board exams, because in every university, every program, if you want to get a license in the US, you need to pass national board exams. And how that's done, that's a different topic. If you want, I can explain you, but that's totally different. You need to pass national board exams. Then you have to get your transcripts from Pakistan evaluated and converted into into their credentials, basically. So it's ECE and WES. These are two companies that changes your credentials, and they give you a GPA. Make sure you do that. So once these three things are done, then you can apply for DDS program, or you can apply for any residency, or you can apply for any program where you can do some training in the US and come back to Pakistan. So these three are very important, and yeah, TOEFL exam is a must when you were saying language proficiency. Yeah.
So IELTS is of no use?
I don't think so. IELTS is accepted. That
Because mostly people over here, they do have this, that maybe for language proficiency, IELTS is given, that's good enough.
No. Because I remember when I applied, that was a long time ago, but every university asked me for TOEFL. And I actually, when I was in Pakistan, I did IELTS, and then I was like, hey, I'm done, let's go.
Exactly.
Yeah, but when I went there, I had to appear in TOEFL exam because they didn't accept my IELTS. They were like, we would like TOEFL. So, and yes, there's one more thing. TOEFL has a criteria of this, like there are 4 sections. There's speaking, listening, reading, and writing. Yes. So each section has a different individual score. For example, UCLA, they would want 90 and above, 22 and above in every section. So if you have a 21 score, but your overall is above 92, they will still not call you. So please look into the applications, the supplemental applications, and look into the individual scores, how much they want, and and then apply. Yeah.
Okay, so do you think studying abroad contributes to an individual's personal and professional growth?
Yes, very, very much. You learn how to be very adaptive. You learn intercultural communication. You understand to handle different challenges in life. You become very independent in making your life decisions. I think when we live here, we are so sheltered, and our decisions are being made by
that was my
other
next question.
people.
Like, what are the cultural adjustments that you have to go in? Because over there it's independent, completely independent.
Yeah. So
While here you're just like under the shelter of everybody, so you feel protected. But over there it's just you who has to do everything.
yeah. So for example, the time management is very. It's like grade A, over there. So you have to be on time. You have to be punctual, and the ideology of the client is always right, the patient is always right. We practice that a lot. So they treat you how to be very patient with the patient, so you can listen to their complaints, you can listen to their concerns. You are present for them. So be very calm, and as a professional, it kind of grooms you a lot, and little disturbance doesn't really bother you then. And yes, there's one more thing. In the US, I am fixing my own unit. I'm taking impressions, and I'm doing the technician work also. So there's a lot of respect in my eyes for the cameraman, for the technician, for the receptionist, because we do everything. That's how we start. So the personality kind of changes. Yeah, they become more grounded.
So are there any internship opportunities for students to apply in the USA?
Yes, there are observership programs, and there is externship opportunity. There must be internship also, but if you go to individual schools, for example, if your family lives in California or in New York, just check the schools, dental schools in that state, and look into the programs they have. I know UCLA does. They have a 2-week program where students from Pakistan or any country, they go and observe. Or if you don't want to do that, you can always contact any dentist in the foreign country and ask them, hey, I want to come in and see how you treat patients. I want to just sit in your study club and get some experience. So yeah, everybody's pretty welcoming. If you shoot them an email, yes, you would be welcome.
So how do you stay up to date with the latest techniques in periodontics and implant dentistry?
So as we know that the dental realm is so vast, we should make it a habit of actually spending some time in the resources. For example, reading articles, attending conferences, meetings, hands-on training, things like that, and implement them. Whatever knowledge and information you get, extract that and implement that into your practice. For example, if I find evidence-based literature saying that certain type of bone grafting material would give me a native bone after histology, then yes, I would invest into that, because that would be beneficial for the treatment outcome. Also, for example, if you find 3D printers, 3D scanners, invest into that, because that would help in better treatment planning of the implants and bone grafting. So little things like that that are evidence-based, and you can invest in that and implement in your practice.
How did your residency training at NYU affect your approach to patient care?
So training at NYU has made me analyzer and to fabricate custom treatment for every patient, which is again evidence-based. Also, we have to make sure that we build a good relationship with the patient, which starts from the first appointment when patient walks into our clinic. And also to understand what the patient wants and not to sell any treatment. For example, if a patient comes in for a very minor, for example, if a patient comes in for a major surgery and I see there's a little minor recession which could be left alone and would not cause any future problems, then I would first educate the patient and tell them that, hey, you have to change your brushing habits, you have to do this, you have to do that, instead of actually jumping onto the treatment. So not to oversell, and if it could be left alone, yes, why not? But prevention and educating the patient is the key. And this is what I've learned: provide evidence-based treatment and make a good relationship with patients.
So what advice do you have for aspiring dentists and periodontists?
So I strongly believe that the people around you affect you a lot, and if you have very positive, like-minded people, they would definitely propel you forward. So I'm very grateful to the mentors that aided me throughout my education, and they still do in my career. So if you are a student, a dentist, or a specialist, surround yourself with very positive and like-minded people that would push you forward in your career growth.
Thank you so much, Dr. Qurat, for taking time out and answering our questions. Do you have any public service message?
Thank you for having me. I had a wonderful time chatting with you. So for the public service message, I would say कि आप लोग जो इतने आराम से गुटखा, पान, छालिया खाते हैं, तंबाकू नोशी करते हैं, इसका आप लोगों को भी इतना एहसास नहीं होता, लेकिन स्लोली आपके जो मुंह है, आपका जो बॉडी है, उसके अंदर प्रॉब्लम्स क्रिएट हो जाती हैं. आपको कैंसर हो सकता है, आपको बहुत सारे गम के प्रॉब्लम हो सकते हैं. तो प्लीज़ कोशिश करें कि ना खाएं और अपने फैमिली में भी इसको एक हैबिट ना बनाएं. शादियों के एंड में, इवेंट पे आप लोग खाते हैं, शीशा पीते हैं, सिगरेट पीते हैं, इन चीज़ों को परहेज़ करें क्योंकि आपकी सेहत के लिए बहुत बहुत ख़राब है. थैंक यू सो मच. Have a good day.
So my message is for the parents कि please अपने बच्चों की dental health को neglect मत करें. I have seen so many kids come to my practice और उनके दांतों का बुरा हाल हुआ होता है. उनको candies बहुत easily available कर दी जाती हैं for them to eat. तो the sticky substance that they eat, the sticky toffee, sticky candy जो वो खाते हैं, वो जब दांतों पे चिपकती है, बच्चों की obviously dental hygiene इतनी अच्छी नहीं होती, क्योंकि ये काम पेरेंट्स का होता है टू सुपरवाइज देयर टूथ ब्रशिंग हैबिट्स, सुपरवाइज कि वो किस तरह सफाई करें. बट आजकल के पेरेंट्स को थोड़ा सा टाइम निकालना चाहिए ताकि अपने बच्चों के दांतों का ख्याल रखें, बिकॉज यही दांत फिर आगे जाके जब परमानेंट दांत आते हैं. आई हैव सीन kids who are 6-7 years old with their permanent teeth coming to me getting for their root canals, and that is just the start. ये permanent दांत ज़िंदगी भर आपने इस्तेमाल करने हैं. तो अगर आप इनका ख्याल नहीं रखेंगे तो बहुत ही जल्दी आप अपने दांत खो बैठेंगे, आपके बच्चे अपने दांत खो बैठेंगे. और आप सबको पता है कि दांत कितने इम्पोर्टेंट हैं हमारी अपनी हेल्थ के लिए. तो प्लीज़ टेक केयर ऑफ़ योर children's dental hygiene and do not neglect it. Thank you.